to adolescent mix and emergency contraception. Faculty disclosure information. Charles J. Wibbelsman, MD. Past 12 months, I have no relevant financial relationships with the manufacturers of any commercial products and/or providers of commercial services discussed in this CME activity. I do not intend to discuss an unapproved/investigative use of a commercial product, device in my presentation. Faculty disclosure information. I do not intend to discuss an unapproved, investigative use of a commercial product, evidence in my presentation. YRBS 2009, CDC. Impact of sexual behaviors. 757,000 pregnancies occur each year among persons aged 15 to 19 years. 9.1 million cases of sexually transmitted diseases occur each year among persons aged 15 to 24 years. An estimated 6,610 cases of HIV/AIDS occur annually among persons aged 15 to 24 years. Increase in birth rates among female adolescents 15-19 years. National Vital Statistics System. Pregnancy, birth, and abortion rates among females aged 15-17 years. United States 1976 to 2006. Percentage of high school students who used a condom during last sexual intercourse, 1991 to 2005. Percentage of currently sexually active high school students who used a condom during last sexual intercourse by race, ethnicity. Percentage of high school students who used birth control pills before last sexual intercourse, 1991 to 2005. To prevent pregnancy, among students who had sexual 0%, 10%, 20%, 30%, 40%, 50%. 0%, 10%, 20%. Setting the stage. Confidential space appearance, examiner and patient respect. The handshake speaking the language of the adolescent, concrete versus abstract. The parentectomy. How to have time alone with the teen. Talking with the parent before, after the visit. The parent who does not want to leave the exam room. Confidentiality. Adolescent health care. California law. How to establish trust with the teen. Confidential phone number. The interview. Asking the tough, sensitive, embarrassing questions. Provider must feel comfortable in asking these questions and with the answers that the teen may give. The interview. Ask the easy questions first. Do your friends talk about sex? Are any of your friends having sex? Are dating anyone or seeing anyone regularly? The interview. How to identify a sexual minority youth. Ask about sexual attractions. Can use scale 1-10. Ask if sexually attracted to opposite/same/both sexes. Ask about sexual behaviors, but do not assume they are having sex. Identify behaviors that may be putting them at risk. How to ask about sexual activity. Be aware of how you ask the question. Concrete answers. What does having sex with another person mean? The presidential definition. Important to ask about specific acts. Oral, vaginal, anal, coitus interruptus. New vocabulary. Sexually active. Active sexually. Actively sexual. How does EC work? Prevents pregnancy primarily or perhaps exclusively by delaying or inhibiting ovulation, and inhibiting fertilization will not work if a woman is already pregnant. ECPs will not cause an abortion. Emergency contraception. Index.jpg. Levonorgestrel versus ulipristal. Two large trials both reported ulipristal resulted in fewer pregnancies. Crude pregnancy rates for ulipristal was 1.28% and levonorgestrel was 2.19%. Ulipristal was more effective than levonorgestrel when taken at 24 hours, 72 hours or 100. Availability. Greater than 17. Plan B is widely available. Under 17, Rx needed for both ulipristal only by Rx at any age, can Rx for males. Approved indications. Levonorgestrel emergency contraception as long as taken within 72 hours after intercourse. Ulipristal as long as taken within 120 hours after intercourse. Emergency contraception and risk-taking. Making emergency contraception more widely available does not increase risk-taking or adversely affect regular contraception use. 13 references app, ACOG, SAM have all supported the availability and use of echintenes. EC use is not associated with increased rates of unprotected intercourse, decreased use of condoms, higher rates of pregnancy or STD. Picture 23.p. Acceptable cost of emergency contraception if it were needed. Emergency contraception for males. Assess knowledge of contraception, specifically emergency contraception which males to offer or EC to condoms only as contraceptive condom broke choices. Plan B. What age to offer to males who offers EC clinic visit/call center in Kaiser Permanente. Plan B dispensed at Kaiser Permanente. There were 8 prescriptions for Plan B picked up for male patients, ages 16 to 32 years, in all of 2010 across Kaiser Permanente Northern California. Health plan membership 3.2 million. Plan B dispensed at Kaiser Permanente. Females age 17 years and younger equals 1,505 prescriptions for Plan B in Northern California. Kaiser Permanente in 2010. Females age 18-24 equals 9,637 prescriptions for Plan B in Northern California. Kaiser Permanente in 2010. Kaiser Permanente and EC. There is no C. Kaiser Adolescent. Health Connect, patient instructions. Imacontracep _bro, teenage,